Thank you so much, Shadrach Miti, for that. Now, let's shift gears to matters health workers in the country. On the 30th of April, health workers, especially nurses, issued a 7-day strike notice to the government, saying that it has failed to give them a compensation agreement and also provide them with protective gears. And this morning, you also expect a press briefing from the health workers union officials on the way forward. Let's speak to the Kenya National Union of Nurses Secretary General Seth Panyako, joining us from a city center studio. Mr. Panyako, thank you for talking to us here on KNUN Center. Let's talk about, let's start, first with matters your strike notice, the 7-day strike notice that you issued. What has the government said so far? Have you had a meeting to try and avert this pending strike?
Thank you very much, Brenda. First, I want to start by saying that we had not issued a 7-day strike notice. What we had done was to inform the government of our grievances that the government was not addressing. So we gave the government a memorandum of demand, and in that memorandum we put in 4 issues. And the first memorandum went to the government, and they hurriedly convened a meeting with us, between the unions and the principal secretary, which lasted less than 10 minutes because the principal secretary told us that it was her meeting and we were to go by her agenda. So basically there was no meeting that took place. The only thing we learned from that meeting was that she told us they promoted doctors in the national government, which are about 200 doctors, and they did not promote other health workers because the other health workers had not been factored in that promotion, because the promotion is based on the new grading structure that has been issued by the Public Service Commission, which has compressed the grades in the public service from 27 to 17. And therefore, we wanted to know why we were not considered. And then when we asked her about the issue of presidential directive on the 2 ministries, that of Ministry of Health and that of Public Service, to prepare a welfare package for frontline health workers, she told us that the negotiation was still going on between her ministry and that of SRC. And at that point, the meeting ended in less than 10 minutes, and we did not have enough time to ask questions because she was rushing to another meeting. So we left the meeting and held our own meeting as leaders of the health workers in Kenya, and we decided to again remind the government. So we gave the government a further 7 days, 5 days that lapsed on Friday last week. In total, we had given the government 12 days. Now, today is when we are now issuing formal written strike notice to the government, of which I think by now the government officers should be being served with a strike notice. We are giving the government 14 days notice to address the issues that are contained in that strike notice, or we begin our strike on 18th of May 2020, exactly 12:01 a.m. The issues we have raised in that strike notice, one is that we need the risk allowance to be harmonized. We cannot have frontline health workers like nurses. Nurses were always considered frontline health workers because we are the first people who come in contact with the patients. And when you look at the statistics that are happening today, infection within health workers, the number of nurses who are infected is very high. When you look at the infections in Mombasa, when they began the massive testing of health workers, out of the 305 that were tested, 10 were found to have a COVID-19 infection, and out of those 10, nurses were 8 and doctors were 2. So when you come to Kenyatta National Hospital, when we had a patient, a child who died and later was found that he was having COVID-19, the health workers who were put under quarantine were 19. Out of those 19, 10 were nurses. So it clearly shows that the people who are vulnerable to this. Yes.
Mr. Panyako, if you can hear me. So you're talking about a 14-day strike notice that's being issued to the government today. And if the government fails to adhere to your demands, today, 18th of May, health services will be stalled. Health services are being given by nurses. But don't you think the strike will put the COVID-19 to test in terms of fighting COVID-19 in the country?
When the government decided to say that it is only doctors who matter in this country, and they promoted doctors in the national government and left out all other health workers, it clearly knew what it was doing. when the government decide that it is only doctors who will not be hired on contract and casual forms, while the other health workers, nurses, clinical officers, medical laboratory nutritionists, and other 17 cadres within the health sector will be employed on casual contracts and dubious engagement in the service, and not affecting one other particular cadre, the government is very much aware of what it's doing. When we are saying that we want those nurses and other health workers who are on those dubious contracts to be regularized into permanent and pensionable terms and conditions of service, if the government does not hit that, then it is the one which knows what it is doing. We cannot continue talking about one thing from the last 3 months. From the day the first case was confirmed in Kenya, we started talking about various issues that we wanted the government to address in order to help us manage COVID-19. And so one of the issues that was not on the table at that time, promotion. Promotion was not there. But when the government itself provoked health workers by promoting 200 doctors and leaving others, it knew what it was doing.
But then you're saying that the Ministry of Health has told you that they're having a conversation with SRC when it comes to the welfare, the financial welfare and the promotion of nurses. Why is it so hard for the union officials to wait for that talk with SRC and see what the government will put on the table before issuing a strike notice?
We have any written commitment from the two ministries. You remember it's now a month since the president gave the directive that the package should be formed. Instead of working on that package and releasing it and also involving we as the leaders of the health workers, what is happening between the government itself, we don't know. You cannot say that the welfare of the health workers will be decided by a clique of one cadre in the health sector. What is the reason why the public service, Minister of Public Service and that of Minister of Health, why are they not involving with the leaders of the health workers so that we tell them what we feel we should be done? Actually, the issue of the strike is not about what is contained in the COVID-19 frontline health workers package as proposed by the President. It is non-involvement of our leadership. That is the point of contention. We want to be involved. We want to know what is coming on the way of our members. We want to negotiate for our members. Because that is why we exist as trade unions.
All right. Thank you so much, the Secretary General of the Kenya National Union of Nurses.